If bloodletting was medieval medicine's most common atrocity, then trepanation, the practice of drilling holes in the human skull, was surely its most terrifying. Trepanation is a surgical intervention in which a hole is drilled or scraped into the human skull. This procedure, performed with primitive tools and no understanding of brain anatomy, represents perhaps the most horrifying intersection of medieval medicine's ignorance and brutality. The practice of drilling a hole in the skull was performed to treat health problems related to intracranial diseases, to release pressure from a head injury, or to provide an escape hatch for evil spirits. The rationale for trepanation reveals the medieval mind's desperate attempt to understand and treat conditions that were completely beyond their medical knowledge. Seizures, mental illness, severe headaches, and behavioral disorders were all attributed to supernatural causes that could supposedly be addressed by creating an opening in the skull. The theoretical justification for trepanation was as varied as it was absurd. Some physicians believed that drilling holes in the skull would release evil vapors that had accumulated in the brain, causing illness and madness. Others thought that trepanation could balance the humors by allowing excess fluids to drain from the head. The most disturbing rationale was the belief that mental illness was caused by demonic possession, and that creating an opening in the skull would provide an escape route for the malevolent spirits trapped inside the patient's head. In the earliest European trepanned skulls, the holes were made by scraping the bone away with sharp stones, such as flint or obsidian. Later, primitive drilling tools were used to drill small holes arranged in circles, after which the piece of bone inside the circle was removed. The evolution of trepanation techniques shows a progression from crude stone implements to more sophisticated metal tools, but all were utterly inadequate for such a delicate and dangerous procedure. The actual process of medieval trepanation was an ordeal that combined surgical trauma with religious ritual. The patient would be restrained, often conscious throughout the procedure, while the physician used various implements to breach the skull. The hole in the skull is usually made by scraping with a sharp knife with a curved tip to avoid injuring the dura. The dura refers to the tough membrane covering the brain, and the medieval physicians' concern about avoiding injury to this structure shows they had some anatomical knowledge, making their willingness to perform such procedures even more inexplicable. The tools used for trepanation were crude and terrifying. The trepan itself was a circular saw-like instrument that was rotated by hand to cut through bone. Elevators, sharp chisel-like tools, were used to pry up pieces of skull bone. Bone forceps allowed physicians to grasp and remove fragments of cranium. All of these instruments were used without anesthesia, antiseptic precautions, or even basic cleanliness standards. The size and location of trepanation holes varied according to the physician's judgment and the patient's supposed condition. Some holes were small, barely large enough to admit a finger. Others were massive openings that removed substantial portions of the skull. The location of the holes seemed to be determined more by superstition than anatomy. Some physicians believed certain areas of the skull corresponded to different mental faculties or spiritual influences. Cranial trepanation was first recorded by Hippocrates, and they did so to alleviate pressure on the brain following an injury to the head or to release evil spirits from the heads of mentally ill people. The fact that this practice had such ancient origins gave it tremendous authority in medieval medical circles. Physicians were following procedures that had been described by the most revered medical authorities of antiquity, lending credibility to what was essentially ritualized torture. The recovery process from trepanation was a nightmare of infection, pain, and neurological damage. Patients who survived the initial procedure faced weeks or months of agony as their wounded skulls slowly healed. Many developed brain infections that proved fatal. Others suffered permanent neurological damage from the trauma to their brain tissue. The lucky ones simply died quickly from the shock of the procedure. Yet perhaps most disturbing of all was the fact that some patients did survive trepanation, and their survival was interpreted as evidence of the procedure's effectiveness. Medieval physicians never considered that survival might be due to the human body's remarkable ability to heal despite medical intervention, not because of it. The technical aspects of medieval trepanation reveal a chilling attention to detail in the service of what was essentially medical torture. Medieval physicians developed elaborate techniques for breaching the human skull, creating specialized instruments and procedures that were passed down through generations of medical practitioners. Understanding these methods provides insight into the methodical nature of medieval medical barbarism. The preparation for trepanation began with elaborate diagnostic procedures designed to determine the exact location where the skull should be opened. Medieval physicians believed that different areas of the head corresponded to different mental faculties and spiritual influences. They created detailed maps of the skull showing which regions controlled memory, speech, emotion, and rational thought. These cranial charts were completely fictitious, but they guided physicians in selecting the site for their surgical assault. The actual trepanation procedure involved several distinct phases, each with its own specialized tools and techniques. The initial phase involved preparing the surgical site by shaving the patient's head and cleaning the scalp, though medieval standards of cleanliness were woefully inadequate by modern standards. The scalp would then be marked to indicate the planned location of the hole, often using measurements based on the patient's finger width or other arbitrary anatomical landmarks. The cutting phase was where the true horror began. The physician would use a sharp knife to make an initial incision through the scalp, cutting down to the bone beneath. This created a flap of skin and muscle that could be peeled back to expose the skull surface. The sight of the white bone beneath must have been terrifying for conscious patients, who were typically restrained but rarely given any form of pain relief. Once the skull was exposed, the actual drilling could begin. Medieval physicians had developed several different methods for creating holes in bone. The scraping method involved using sharp stone or metal implements to gradually wear away the bone surface, creating a depression that was slowly deepened until it penetrated through to the brain cavity. This was an agonizingly slow process that could take hours to complete. The drilling method used circular cutting tools called trepans, the instruments that gave the procedure its name. These were essentially small saws with serrated edges that were rotated by hand to cut through bone. The physician would apply downward pressure while rotating the trepan, gradually cutting through the skull in a circular pattern. The challenge was to cut completely through the bone without penetrating too deeply into the brain tissue beneath. Perhaps most horrifying was the crown and bridge technique, where multiple small holes would be drilled in a circular pattern, then connected by cuts to remove a large piece of skull. This method allowed for the creation of much larger openings, but required extraordinary skill to avoid causing massive brain damage. The removed piece of skull, called a bone button, was sometimes kept as a memento of the procedure. The tools used for trepanation were crafted with the same attention to detail as any other medieval implements. Trepans were made from the finest steel available, with carefully sharpened cutting edges. Some were elaborately decorated with engravings or precious metals, turning instruments of torture into works of art. The contrast between the beautiful craftsmanship of these tools and their horrific purpose epitomizes the contradictions of medieval medicine. Medieval physicians also developed specialized techniques for different types of patients and conditions. Children required smaller instruments and different procedures to account for their thinner skull bones. Elderly patients needed modified techniques to deal with more brittle bone structure. Some physicians claimed expertise in reopening trepanation sites that had healed over, creating permanent holes that could be accessed repeatedly for ongoing treatment. The aftermath of trepanation required its own set of specialized procedures. The exposed brain tissue needed to be protected from infection and injury. Medieval physicians used various coverings, from animal membranes to metal plates, to shield the opened skull. Some patients lived for years with permanently open holes in their heads, covered only by thin layers of protective material. The development of trepanation techniques represents one of the most sophisticated aspects of medieval surgery, which makes its fundamental barbarity all the more disturbing. These were not crude, improvised procedures performed by desperate amateurs. They were carefully refined surgical techniques practiced by the most skilled physicians of their era, handed down through generations of medical education and considered the pinnacle of neurological treatment. The aftermath of medieval trepanation provides some of the most disturbing evidence of the human cost of medical ignorance. While many patients died during or immediately after the procedure, those who survived faced a lifetime of complications, disabilities, and ongoing medical abuse that often proved worse than their original conditions. Archaeological evidence from medieval cemeteries provides chilling testimony to the prevalence and outcomes of trepanation. Skulls bearing the telltale holes of trepanation procedures have been found throughout Europe, offering forensic evidence of this widespread practice. What makes these discoveries particularly haunting is that many skulls show evidence of multiple trepanation procedures, indicating that patients who survived their first skull drilling were subjected to repeated operations. The healing patterns visible in ancient skulls reveal the range of outcomes for trepanation patients. Some skulls show smooth, well-healed bone around the trepanation sites, indicating that the patient survived long enough for the bone to regenerate. Others display rough, infected-looking bone growth, suggesting that the patient suffered from chronic infection and inflammation. The most disturbing specimens show no healing at all, indicating that the patient died during or shortly after the procedure. Mortality by one authority is described as low, perhaps, but this assessment seems wildly optimistic given the primitive conditions under which these procedures were performed. Medieval physicians had no understanding of antiseptic technique, brain anatomy, or surgical shock. They performed major neurosurgical procedures with unsterilized instruments, no anesthesia, and no ability to control bleeding or manage complications. Patients who survived the initial trepanation procedure faced a host of potential complications. Brain infections were common, as the open wound provided a direct pathway for bacteria to enter the cranial cavity. These infections often proved fatal weeks or months after the surgery, deaths that medieval physicians attributed to the patient's underlying condition rather than the procedure itself. Neurological damage was virtually inevitable in trepanation survivors. The crude drilling techniques often caused direct trauma to brain tissue, resulting in seizures, paralysis, speech disorders, and cognitive impairment. Patients who had been mentally ill before trepanation often emerged from the procedure with additional disabilities that made their lives even more difficult. The psychological trauma of trepanation cannot be understated. Conscious patients experienced the full horror of having their skulls drilled open, often while being physically restrained. The sounds, smells, and sensations of the procedure must have been utterly traumatic. Many survivors probably suffered from what we would now recognize as post-traumatic stress disorder, adding psychological suffering to their physical disabilities. Perhaps most tragically, the supposed success of trepanation procedures led to repeat operations on the same patients. Medieval physicians interpreted survival as evidence that the procedure was working, and any continuation or recurrence of symptoms was seen as justification for additional drilling. Some skull specimens show 3, 4, or even more trepanation holes, indicating that these unfortunate individuals were subjected to repeated cranial surgeries throughout their lives. The social consequences for trepanation survivors were severe. In medieval society, visible disabilities were often interpreted as signs of divine punishment or moral failing. Patients with obvious head wounds and neurological impairments faced discrimination, social isolation, and economic hardship. Many probably ended up as beggars or social outcasts, their medical treatment having destroyed their ability to function normally in society. Family members of trepanation patients also suffered the consequences of these procedures. They watched loved ones undergo horrific surgical ordeals, often paying substantial fees for treatments that left their relatives permanently disabled or dead. The economic burden of caring for disabled trepanation survivors could devastate medieval families who were already living at subsistence levels. The medical establishment's response to trepanation complications reveals the self-serving nature of medieval medical practice. Rather than questioning the wisdom of drilling holes in patients' skulls, physicians developed elaborate explanations for poor outcomes. Failed procedures were attributed to the patient's moral failings, astrological influences, or improper preparation rather than the fundamental flaws in the treatment itself. While bloodletting and trepanation were the most dramatic expressions of medieval medical ignorance, they were merely the tip of an iceberg of barbaric treatments that terrorized patients across Europe. The medieval medical establishment had developed an extensive arsenal of procedures, potions, and practices that were often more dangerous than the diseases they purported to cure. Purging represented another cornerstone of medieval medical practice, based on the same humoral theories that justified bloodletting. Physicians believed that illness could be cured by forcing patients to violently expel the contents of their digestive systems. They administered powerful laxatives and emetics, substances designed to cause vomiting, in doses that would shock modern medical practitioners. Patients were subjected to hours of uncontrollable diarrhea and vomiting, losing dangerous amounts of fluid and becoming severely dehydrated. The substances used for purging were often toxic in their own right. Mercury, antimony, and various plant-based poisons were commonly prescribed as purgatives. These heavy metals and toxins caused severe damage to the digestive system, kidneys, and nervous system. Many patients who might have recovered from their original illness died from mercury poisoning or other complications of purging treatments. Cauterization, the practice of burning human tissue with hot irons, was another medieval medical favorite. Physicians believed that applying intense heat to specific body parts could restore humoral balance and cure various ailments. Red-hot irons were pressed against patients' skin, creating severe burns that often became infected. The agony of cauterization was considered therapeutic, with physicians believing that the pain itself had healing properties. Medieval surgery, when it was attempted at all, was performed without anesthesia, antiseptic precautions, or adequate anatomical knowledge. Surgeons would amputate limbs with crude saws, remove tumors with rusty knives, and attempt to repair internal injuries with no understanding of anatomy or physiology. The mortality rate for surgical procedures was catastrophic, yet the few survivors were held up as proof of surgical skill rather than evidence of extraordinary luck. The treatment of mental illness in medieval times reveals perhaps the darkest aspects of medical practice. Patients suffering from depression, anxiety, schizophrenia, or other psychological conditions were subjected to treatments that were essentially torture. Beyond trepanation, these unfortunate individuals were beaten with rods to drive out evil spirits, submerged in ice-cold water until they nearly drowned, and subjected to starvation diets designed to weaken their supposed demonic possessors. Urine therapy occupied a prominent place in medieval medical practice, with physicians believing that drinking one's own urine could cure a variety of ailments. Patients were instructed to consume their morning urine as a daily treatment for everything from digestive disorders to skin conditions. The practice was based on the belief that urine contained the body's excess humors and that consuming it would restore balance. Perhaps most disturbing was the medieval treatment of women's health issues. Female reproductive anatomy was poorly understood and heavily stigmatized, leading to treatments that were both medically useless and psychologically traumatic. Wandering womb syndrome was a common diagnosis for women experiencing any form of physical or emotional distress. The treatment involved various attempts to coax the supposedly displaced uterus back to its proper position, including fumigation of the vagina with burning herbs and the insertion of various objects into the birth canal. Childbirth in medieval times was a medical nightmare that killed countless women and infants. Midwives and physicians had no understanding of sterile technique, proper positioning, or emergency procedures. Women who experienced difficult labors were subjected to violent manipulations, given toxic substances to speed delivery, and often died from infections introduced during the birthing process. The high maternal mortality rate was accepted as divinely ordained rather than medically preventable. The medieval approach to infectious diseases was equally horrific. During plague outbreaks, physicians prescribed treatments that actually accelerated the spread of disease. They recommended bleeding plague victims to reduce their fever, weakening patients who desperately needed to conserve their strength. They prescribed various concoctions containing mercury, arsenic, and other poisons that added toxic poisoning to an already deadly infection. Dental care in medieval times was limited to extraction using crude forceps and no pain relief. Tooth problems were attributed to tooth worms that supposedly burrowed into the teeth, and treatments involved attempting to kill these imaginary parasites with hot irons inserted into the mouth. Many patients died from infections that spread from untreated dental abscesses to the brain and heart. The treatment of battlefield injuries reveals the medieval medical establishment's complete lack of understanding about trauma care. Wounded soldiers were subjected to immediate bloodletting to prevent fever, had their wounds cauterized with red-hot irons, and were given toxic medications that often proved more dangerous than their injuries. The survival rate for serious battlefield wounds was appallingly low, not because the injuries were necessarily fatal, but because the medical treatment was so harmful. The most disturbing aspect of medieval medical practice is not that it existed, but that it persisted for centuries, despite overwhelming evidence of its ineffectiveness and harm. Understanding why these barbaric practices continued for so long reveals the powerful forces that can perpetuate medical ignorance, even in the face of mounting casualties. The authority of ancient texts played a crucial role in maintaining harmful medical practices. Medieval physicians were trained to revere the writings of Galen, Hippocrates, and other classical authorities as infallible truth. Questioning these ancient sources was considered not just medically heretical, but intellectually arrogant. This created a medical culture that valued scholarly authority over empirical observation, ensuring that dangerous practices would continue regardless of their actual outcomes. The Church's influence on medical practice cannot be overstated. Religious doctrine taught that illness was often a result of sin or divine punishment, making medical intervention a form of spiritual as well as physical healing. This theological framework made it difficult to abandon treatments that were sanctioned by religious authority, even when they proved deadly. Physicians who questioned established medical practices risked being accused of challenging divine will. The economic interests surrounding medieval medicine created powerful incentives to maintain the status quo. Bloodletting, trepanation, and other procedures were highly profitable for physicians, barber-surgeons, and related tradespeople. Admitting that these treatments were harmful would have destroyed the livelihoods of thousands of medical practitioners. Economic self-interest ensured that evidence of medical harm would be ignored or suppressed. The lack of systematic medical record-keeping made it difficult to document the true costs of medieval medical practice. Physicians rarely tracked the long-term outcomes of their treatments, and there was no system for comparing different therapeutic approaches. Without reliable data, it was easy to attribute treatment failures to the patient's condition rather than the treatment itself. Medieval society's acceptance of high mortality rates also contributed to the persistence of harmful medical practices. Death was so common in medieval life that extraordinarily high mortality rates among medical patients didn't seem unusual. Families expected that seriously ill relatives might die, regardless of medical intervention, making it difficult to recognize when medical treatment was actually causing harm. The isolation of medieval medical communities prevented the spread of information about treatment outcomes. Physicians rarely communicated with colleagues in other regions, so local observations about the dangers of certain procedures weren't shared widely. This meant that harmful practices could persist in one area even if physicians elsewhere had discovered their dangers. Perhaps most importantly, medieval medicine lacked any concept of controlled experimentation or statistical analysis. Physicians made treatment decisions based on theoretical frameworks rather than empirical evidence. They never conducted studies comparing different treatments or measuring outcomes objectively. This meant that even obviously harmful practices could continue indefinitely because no one was systematically evaluating their effectiveness. The social status of medieval physicians also protected them from criticism. As educated, wealthy members of society, physicians were rarely questioned by their patients or the general public. Their medical authority was reinforced by their social position, making it difficult for victims of medical abuse to seek redress or even recognition that they had been harmed. The medieval understanding of disease causation made it easy to explain away treatment failures. If a patient died after bloodletting, the death could be attributed to demonic possession, astrological influences, or divine will rather than medical error. This provided physicians with ready-made excuses for poor outcomes that absolved them of responsibility for their patients' suffering. The guild system that governed medieval medical practice actively suppressed innovation and criticism. Medical guilds protected their members' interests by maintaining strict control over medical education and practice. Physicians who advocated for alternative treatments or questioned established practices faced professional ostracism and economic ruin. As we emerge from this journey through the blood-soaked corridors of medieval medicine, we are left with a sobering reminder of what happens when ignorance masquerades as knowledge, when tradition trumps evidence, and when economic interests override patient welfare. The horrific practices we have examined, bloodletting, trepanation, and the countless other barbarities of medieval medical practice, were not the work of sadistic madmen, but of respected physicians who genuinely believed they were providing the best possible care. The scale of suffering caused by medieval medicine is impossible to calculate. Across Europe, for nearly 1,000 years, millions of people sought medical help only to find torture, mutilation, and death. Children were bled to death in the name of preventing illness. Women died in agony from complications of crude surgical procedures. Men had their skulls drilled open to release imaginary demons. The elderly were purged and cauterized until their weakened bodies could no longer survive the supposed cure. Yet perhaps most disturbing of all is the realization that medieval physicians were not uniquely evil or ignorant compared to their contemporaries. They were products of their time, working within the intellectual and cultural constraints of medieval society. Their willingness to inflict suffering in the name of healing reflects broader medieval attitudes toward pain, authority, and the nature of knowledge itself. The persistence of obviously harmful medical practices for centuries demonstrates the powerful forces that can perpetuate dangerous ignorance. Economic interests, religious doctrine, social hierarchies, and intellectual arrogance combined to create a medical system that was remarkably resistant to change or reform. Even when evidence of harm was overwhelming, these forces ensured that barbaric practices would continue. The medieval medical experience offers profound lessons for our own time. It reminds us that medical authority is not infallible, that established practices can be profoundly wrong, and that patient suffering is not always an acceptable price for medical progress. The physicians who bled their patients to death were as convinced of their method's validity as any modern doctor is of contemporary treatments. We must also recognize that the transition from medieval to modern medicine was not sudden or complete. Bloodletting continued well into the 19th century, with George Washington reportedly dying from excessive bloodletting prescribed by his physicians. Trepanation persisted in modified forms into the modern era. The superstitious thinking that characterized medieval medicine didn't disappear overnight, but evolved gradually into more scientific approaches. The medieval medical experience also highlights the importance of empirical observation, controlled experimentation, and systematic record-keeping in medical practice. The absence of these scientific methods allowed harmful practices to persist for centuries. Only when physicians began to systematically observe and measure treatment outcomes did medical practice begin to improve. Perhaps most importantly, the story of medieval medicine reminds us of the fundamental ethical obligation of medical practitioners. First, do no harm. The medieval physicians who bled and tortured their patients believed they were helping, but their good intentions could not justify the massive suffering they caused. Modern medicine's emphasis on evidence-based practice and patient safety represents a hard-won victory over the kind of medical barbarism that characterized the medieval period. The dark legacy of medieval medicine should serve as a perpetual warning against medical arrogance, economic exploitation of patients, and the uncritical acceptance of medical authority. The blood that flowed from medieval bloodletting bowls, the screams that echoed from trepanation procedures, and the countless lives lost to medical ignorance must not be forgotten. They represent the price of abandoning scientific method, critical thinking, and genuine concern for patient welfare.